unpaid position. I do not receive any financial compensation for what I do for National Vapers Club. I also organized a research project called the IVAX project, where we studied the components of e-cigarette vapor and compared them to the components of tobacco smoke. The project is now in its final stages. For full disclosure, I started an e-commerce business selling e-cigarettes about 2 weeks ago. I wanted to wait until we had data back from our project to make sure that I wasn't selling anything that was really bad. Nobody wants to have that guilt. The number one problem for The number one problem for most smokers is that traditional FDA-approved MRTs do not work. The nicotine alone is often not enough to break a lifelong habit of 2, 3, or 4 decades. E-cigarette users are mostly very long-term smokers who have been smoking for most of their lives. I've spoken to thousands of e-cigarette users, who we call vapers, in the past 3 years, and they all say the same thing. It's not just the hand-to-mouth behavior of moving your hand to your mouth, but it's the sensation of something going down your throat and the visual imagery of seeing vapor floating in front of you that's important to them. If you watch YouTube reviews, on the internet, you can see people reviewing electronic cigarettes and saying, this one has good throat hit or good vapor production, and they talk about it because this is what's important to them to maintain, abstinence from cigarettes. Scott Ballin mentioned earlier the term smoking replacement products. And for e-cigarette users, that's what this is. It's not a replacement. You're not replacing nicotine. Replacing nicotine is not often enough. You need to replace the habit of smoking, especially for people who've been doing this for most of their lives. In numerous surveys, smokers found e-cigarettes to be more acceptable than FDA-approved NRTs as a substitute to smoking traditional tobacco cigarettes, for the reasons listed. Jonathan Folds' survey in 2011 and this year that was recently published, and it showed that experienced e-cigarette users had tried to quit smoking an average of 9 times before they started using the e-cigarette. 2/3 of those people had previously tried to quit smoking using an FDA-approved medication, and obviously they failed because they were still smoking. A published survey suggests that the general public has been misinformed that using nicotine is just as bad for you as smoking. People come up to me every day and they say, well, isn't it just as bad because it still has nicotine in it? And, I don't know what to say to them to convince them that nicotine is not as bad as inhaling, 5,300 chemicals into your lungs. While nicotine may not be 100% safe, it is certainly safer than inhaling combusted tobacco smoke. We need to change the public misperception about nicotine to let people understand that the nicotine is not what's causing all of these smoking-related illnesses. All the current studies which report TSNA levels in e-cigarettes show that they are lower than or comparable to FDA-approved NRT products. And I think I am on the wrong slide. There we go. This chart compares TSNA levels of various tobacco and nicotine products. As you can see, Health New Zealand's testing tells us that 8 nanograms of TSNAs can be measured in 1 e-cigarette cartridge. An FDA-approved nicotine patch contains the same measure of carcinogens. There are no cancer warnings on the patch because 8 nanograms is such a minute quantity that it's highly unlikely to cause cancer. If you notice the bottom number, that would be the TSNA level in Marlboro cigarettes, which is 11,190 nanograms. The difference is so extreme that you can't not recognize the difference. And while, it's been noted earlier today that you can't be sure that lowering the TSNAs is going to lower the cancer level, cancer risk, that's what we're here for. We're here to modify the risk. So if that's what we think can do it, we have to do it. In July of 2009, the FDA announced that the agency found carcinogens and antifreeze in electronic cigarettes. But the FDA press release failed to specify that the quantity was so low that it was the same as their approved patch. They also failed to mention that the antifreeze or diethylene glycol was not found to be a toxic level, which is why the product was not pulled off the market. So Terra Inc., which makes a company that makes e-cigarettes, also tested Enjoy e-cigarettes and found that only 1 TSNA was at a measurable level, and it's not considered by IARC because it's considered to be carcinogenic in humans. National Vapers Club did this study on e-cigarettes, and we found comparable levels of TSNAs to previous studies. In addition to TSNAs, IVAX consumer groups support the regulation of e-cigarettes as a tobacco product, and we believe the FDA needs to keep these regulations reasonable. We just want to make sure that they make it affordable and make it available for these people, these companies, to be able to provide a product that has less risk. Many of these tobacco companies and e-cigarette companies can't afford to go through the process that we expect that they'll ask for, so we hope that the FDA will be reasonable and provide a smokeless alternative. E-cigarettes eliminate the smoke, they eliminate a lot of the carcinogens, a lot of the toxins, and we hope that we can make it easier for people to get them and keep them regulated so that they're safer. If anybody has any questions, all of the, I missed our last slide here. We need to make sure it's affordable to tell the truth. All of our references for comments are at vaporsclub.com/science.php, and anyone who has any questions can feel free to contact me.
Thank you, Mr. Klein. Our 10th speaker is Godshall from Smoke-Free, Pennsylvania.
Hello, I'm Bill Godshall, founder and executive director of Smoke-Free Pennsylvania, a nonprofit organization that since 1990 has been advocating local, state, and federal policies to reduce indoor tobacco smoke pollution, reduce tobacco marketing to youth, hold cigarette companies accountable in civil courts, increase cigarette tax rates, fund tobacco education and smoking cessation services, inform smokers that all smoke-free tobacco and nicotine products are far less hazardous alternatives to cigarettes. And in 2007, I convinced Senator Mike Enzi to amend the Tobacco Control Act during the Senate Health Committee's markup session to require color graphic warning on all cigarette packages that should be required next year. For disclosure, neither Smoke-Free Pennsylvania nor I have ever received any direct or indirect funding from any tobacco, drug, or electronic cigarette company or trade association. It is important to recognize that Section 911 and other provisions of Chapter 9 of the Tobacco Control Act only apply to cigarettes, cigarette tobacco, roll-your-own tobacco, and smokeless tobacco products. Although the FDA has stated that it intends to propose a regulation to apply Chapter 9 to all currently unregulated tobacco products, Section 911 currently does not apply to small cigars, large cigars, pipe tobacco, hookah shisha tobacco, electronic cigarettes, e-liquid, tobacco skin cream, nicotine water, and at least 2 dissolvable tobacco products. Thus, there appears to be 3 different types of modified risk applications that tobacco companies might submit to the FDA. 1, comparing a smokeless tobacco product to cigarettes. 2, comparing a cigarette to another cigarette. 3, comparing a smokeless product to another smokeless product. Since there's no scientific evidence indicating that any type of cigarette is less hazardous than any other cigarette, and since there is insufficient evidence indicating that any type of smokeless tobacco product is less hazardous than any other smokeless tobacco product used in the United States, the FDA should require additional studies for modified risk applications seeking to claim that one cigarette is less hazardous than another, and for those seeking to claim that one smokeless tobacco product is less hazardous than another. In sharp contrast, however, a growing body of scientific evidence has found that daily use of smoke-free tobacco products marketed in the United States and Sweden pose about 99% fewer mortality risks than cigarettes. That's 99%. And that switching to a smoke-free tobacco product reduces a smoker's mortality risk nearly as much as quitting all tobacco and nicotine. Non-smokers are also exposed to far less tobacco smoke when smokers switch to smokeless tobacco products. In fact, MRTP products and smokeless tobacco products have very similar health risk and benefit profiles. Since more than 99% of all tobacco attributable deaths and healthcare costs in the United States are caused by the repeated inhalation of tobacco smoke, and that less than 1% are caused by smokeless tobacco products, it is vitally important for the FDA to publicly acknowledge the exponential differences of risk between cigarettes and smokeless tobacco, and to take this into account when considering criteria for evaluating modified risk applications. Even in the absence of reduced risk marketing claims, population surveys found that several million smokers have already switched to smokeless tobacco products, despite numerous surveys finding that most smokers inaccurately believe smokeless products are just as hazardous as cigarettes. So smokeless tobacco products have already saved more lives of smokers than could be offset, even if every American non-tobacco user begins to use smokeless tobacco. Besides, federal and state laws and the 1998 Master Settlement Agreement already prohibit the marketing of smokeless tobacco products to youth. The questions posed by the FDA to presenters at this conference inaccurately presume that there's no evidence that smokeless tobacco products are less hazardous than cigarettes. If the FDA desires further evidence that the marketing of smokeless tobacco to smokers as less hazardous alternatives won't harm public health, the agency should consider that electronic cigarettes have been marketed to smokers as less hazardous alternatives for several years. As a result, smokers who switch now account for virtually all e-cigarette consumers. There is no evidence that youth or non-tobacco users have begun using e-cigarettes, and surveys of e-cigarette consumers have found that nearly all perceive significant health benefits from switching to e-cigarettes, and that most e-cigarette users had failed to quit smoking previously by using FDA-approved smoking cessation drugs. In sum, there's no justification for FDA to require any new studies for the approval of modified risk applications seeking to claim that a smokeless product is less hazardous than cigarettes. Any regulation requiring smokeless tobacco companies to conduct additional studies to make that claim is tantamount to a truth tax. Just as heroin addicts and the public have a right to be truthfully informed that methadone, clean needles, and condoms can reduce risks of transmitting and contracting HIV, hepatitis, and other diseases, tobacco consumers and the public have a human right to be truthfully informed that smokeless tobacco products are far less hazardous alternatives to cigarettes. Just as the U.S. Public Health Service had an ethical duty to inform black syphilis patients in the infamous Tuskegee study that effective syphilis treatments were available, the FDA and public health agencies have an ethical duty to truthfully inform tobacco consumers that smokeless tobacco is far less hazardous than cigarettes. But since 1986, when Congress enacted the Comprehensive Smokeless Tobacco Education Act, public health agencies have intentionally misled the public to believe that smokeless tobacco products are just as hazardous as cigarettes, which has discouraged tens of millions of smokers from switching to smokeless and has encouraged some smokeless users to switch to cigarettes. Despite repeated assertions that the FDA will rely upon scientific evidence, the FDA's webpage about Section 911, that is ironically titled Health Fraud, states falsely in bold letters, to date, no tobacco products have been scientifically proven to reduce risk of tobacco-related disease, improve safety, or cause less harm than other tobacco products. Although the Food and Drug Administration has stated it will comply with Judge Richard Leon's ruling that e-cigarettes are tobacco products, the FDA hasn't clarified or corrected any of Josh Sharfstein's prohibitionist, fear-mongering propaganda about e-cigarettes. The FDA's website still contains inaccurate and misleading information about the risks and benefits of e-cigarettes, still falsely claims that e-cigarettes are marketed to youth, and still falsely claims that e-cigarettes are unapproved drug devices, which continues to be cited in news stories and by prohibitionists to continue to deceive the public. The FDA has also invited many abstinence-only tobacco prohibitionists to join its staff, its TIPSAC, and to present at this workshop, while inviting very few, if any, harm reduction advocates or tobacco consumers. It was wrong for cigarette companies to mislead the public about the health risks of cigarettes for decades, but it's far worse for the FDA, health agencies, organizations, and/or professionals to mislead the public about the comparable risk of cigarettes and smokeless products. As long as the FDA and health agencies continue to misrepresent the health risks of smoke-free products, the public will justifiably continue to distrust the FDA on other critically important public health issues. Ironically, last year, the FDA held a workshop entitled Risk Benefits of Long-Term Use of Nicotine Replacement Therapy, and there appeared to be a consensus that long-term use of MRTP poses very few, if any, health risks, because long-term use of Swedish snus poses very few, if any, health risks. I suggest the FDA's Tobacco Center staff review presentations and discussions at that conference.
Okay, it's your time's up.
Thank you.
Thank you. Mr. Godshall, our 11th speaker